Alrighty, thanks. Well, October is Breast Cancer Awareness Month, and this week our very own Riley Phillips sat down with Dr. Amjad to talk about the importance of screenings in this week's Ask the Doc.
Well, thank you for joining us this week, Dr. Amjad. And October is Breast Cancer Awareness Month, so now is the time to spread awareness about the importance of screenings. So when should someone be screened for breast cancer?
So breast cancer is usually by age 40 is when we start recommending it. And some doctors will tell patients different things. I tend to tell patients above age 40, if you ask the Cancer Society or gynecologist, 40 to 50, but 40 years old is when we want to start screening.
And if there is a family history of breast cancer, should someone get screened sooner in life?
Yes. So if someone has a family history, a first-degree relative, a mother, sister, first-degree aunt, then we want the cancer screened earlier. So about 10 years then their diagnosis. So if you have a 40-year-old family member who has cancer of the breast, in your early 30s, we start screening you.
Now, breast cancer isn't something that just happens to women. Can men also get breast cancer?
Yes, so men can get breast cancer too, and it's very rare. But men can have it. We do mammograms, ultrasounds on men too. Family history takes a part into that, and then, of course, any abnormal findings that a man might find.
And now we have a viewer question to get to tonight. Now, this person wants to remain anonymous, and they want to know more about losing weight. Will it help with multiple liver cysts and fatty liver? And if so, what percentage of body weight should they lose?
So thank you to our viewers. And I do want to remind our viewers that all our comments and questions are not to diagnose or to treat anyone. You know, we'd want to ask questions and answer them, but still need to talk to your doctor. The question about the liver cysts and the fatty liver, so losing weight does help a fatty liver. Just imagine even any type of organ in the body is going to have fat around it. So if you've gained weight or have high cholesterol, that can go around the fatty liver. It doesn't affect the cysts as much. There are some medications that can cause cysts in the liver. Birth control is one of the common ones we think about. So losing weight can help a fatty liver, but it doesn't necessarily affect the cysts that I'm aware of.
And now these symptoms of this condition are actually impacting the viewer's daily life. Do you have any advice for them?
If it's causing pain in the belly, if that's what I'm thinking, if that's what she's referring to or he, then you'd want to see your doctor and talk about it. Losing weight does help, but if it's causing problems in your daily life, you need to see your doctor, maybe do some other tests to see why it's hurting so much.
All right. Well, thank you for joining us this week, Dr. Amjad.
Thanks.
Ask the Doc is brought to you by these community-minded sponsors.
And if you have questions for the